a little bit, but hopefully it'll give me that notification soon. There we go. All right. Well, thank you for joining us today for another session of our winter warming series. I have Jill Zimmerman with me today, one of our PAs here, and we are going to talk about light therapy and vitamin D. Let's go ahead and get started. So we are going to start with light specifically. And one thing, actually, this is funny. So light does impact, as I'm sure we've probably all experienced, right? It impacts our mood and our energy levels. And so one thing in winter to help with that is let the natural light pour in. It's funny because I just had to close all the blinds, and now I see
that one.
I should have closed that one too. But if you're not doing a presentation, opening up the blinds, like, all the way up so that you can let as much light in, that can really be helpful. And on days where it is dark, then using your lights that you have in your house to kind of match with the natural progression of the days, what the day's light would have been, can also help to keep your circadian rhythm in its natural flow. So turning more lights on in the morning when it's bright, and as the day goes on, turning those off and switching more to the lamp lights. One thing I will say as a caveat for that is that warmer lights tend to create a more like calm, peaceful environment, and more creative space. Yes, yeah, versus fluorescent. So like personally in my office, other than like, when it's sunny, having all those windows open, I really don't like the big fluorescent lights on. But that's because the work that I do in here it suits better to have that more like calming, peaceful space. Let's see. And another thing that I had wanted to share, talking about lights and therapy, and I know that we've shared some of these things before, but prioritizing the morning light can really have a big impact, not only on your mood, but also your energy, and your body's ability to regulate your melatonin production. So getting out in the morning, just 10 to 15 minutes, even if it is cloudy, actually. Studies have found that really helps to regulate, like I said, especially that melatonin production, which we all know if we're sleeping better, then it's easier to get up. Excuse me, I have a tickle in my throat. And then the other thing too, let me grab a drink here.
One is you're talking about some of the light therapy too, that we talked, and again, we've talked about this before too, is that there are some of the, maybe it's coming up in what you're going to talk about, is the sunlights. Yeah.
Yes. Do you want to talk about that?
So yes, I will. So with the sunlights, you can buy those. I had roughly priced them out on Amazon, and generally felt as if you did somewhere between a $30 and a $50 sun lamp. You do want to designate about 15 to 30 minutes in front of the sunlight. You want to be about 16 inches from it. So just to kind of turn it on and have it be in the room is probably not the greatest way to use it if you're going to invest into one of the sunlights. And they recommended about 10,000 lux. I hope I'm saying that right. If the lower the lux, then the longer the time is that you need to spend in front of it. But sometimes that can be helpful if, say, you work all day in an office without sunlight, that maybe, again, as if you eat your lunch at your desk, maybe you turn that light on so that you can get some of that, I'll say the good sunlight from that. And then I know you're going to also touch on some of the alarm clocks. Now, those aren't true sunlight.
Right. Yeah, but there are artificial sunlight alarm clocks. There's a different name for it that I'm not coming up with right
Sunrise?
now. Yes, artificial sunrise alarm clock. Thank you. And those can be really helpful. Again, they do have a setting where you can just have it on and you could choose the brightness. So it's not the same like therapeutic setup as those other more specific therapy lights are. But they still can be another helpful way to brighten your room to the setting, the degree that you need. And then the alarm clock part, of course, can be really helpful for, I don't know about you, Jill, but in the winter, if it's dark when my alarm goes off, I don't want to get up.
Yeah.
Whereas in the summer, I have no problem, and a lot of times I'm up before my alarm. So they can kind of help to gradually brighten the room,
Yeah.
make it easier to get up.
I think you and I have talked about this too, is that I don't have one of those sunrise alarm clocks. I'm not sure why I haven't invested, but I haven't. But I do have a hard time in the winter, especially when it's just so dark and it's cold. And so a lot of times what I'll do is I'll set my, maybe this is good or bad, but I'll set my alarm maybe like 10 minutes earlier than I need to be up. And so when that alarm goes on or goes off, I then click on my bedside lamp. And then
Oh,
I'll fall
smart.
back to sleep, but then the next time when I do have my alarm go off in whatever 9 or 10 minutes, then there's actually a light on.
Yeah, DIY.
Yes. Yeah.
That's smart.
Yeah.
Well, that's a good way to do it. I do really like I have an artificial sunrise alarm clock, and it's made a huge difference
That's
for
good.
me.
Do you use
Doesn't
it with your kids at all?
They don't have a problem getting up.
Okay. All right.
No. But it doesn't bother my husband. I should probably reset it at a time because it might help him actually if I
True.
reset it at a time that he wants to get up. But usually the kids wake him up. So
True. One thing about doing the light to help our moods and everything like that, I know that having lived through the 80s and the 90s, I know that many of us continue to use tanning beds throughout the winter months, and that people say that they do feel better. Again, it is a light. It's kind of like me turning on my bed lamp. It's not necessarily a sunlight lamp. The tanning beds actually block the UVBs, which is what we need for absorption for the vitamin D.
Okay.
So there's really, I hate to be the person wearing the white coat in the room.
That was a
say
good transition.
there's
Yeah.
really not a good reason to go to a tanning bed.
Okay. There's no medical.
No.
Actually,
no.
there's medical reasons against it, right?
Yeah. Yeah.
It just makes you feel warm.
Yeah. And truth be told, it took me years, probably in the 90s, to get off tanning beds. But that's what happens when you're born in the
Yeah.
80s. Yeah. Yeah. So we're talking about vitamin D. So you're right. It is a good transition to talk with vitamin D. So again, we absorb vitamin D through our skin after having exposure with the sun about 15 to 30 minutes. It is the UVB, so it is also the rays that can burn our skin. So sometimes we have to be careful on the prolonged time that we might be out there without sunscreen. And what's tough is that we live in Wisconsin, so we have the darker times of year, the times that we're unfortunately not out as much as maybe the summer and spring months. And then, of course, you have people like me that tell you need to wear your sunscreen. And that you can absorb some of the UVB with sunscreen, because of course our skin does still tan if we're wearing sunscreen, but the higher the SPF, it's the more that it's going to block. And so I also would hesitate to say that you do have to spend some time with limited sunscreen on, or hats or sun shirts or everything like that, just so that you can get that proper absorption. Fun fact is that your body can only absorb that kind of max amount of vitamin D that it needs in a max of 15 to 30 minutes, and then you should take a break before you would again re-expose yourself if you're doing it solely for the vitamin D purpose, if that makes sense.
Yeah, that's interesting.
So vitamin D it's in some foods, but few, and maybe some of the foods might not be as palatable to most of us in looking at it. It can be found in some of the good fat fish, like salmon, swordfish, tuna, and mackerel. It also can be in herring. I know that's a Wisconsin tradition, right?
Pickled herring.
We did pickled herring.
Yeah,
at Christmas and New Year's.
That makes sense.
Now I'm just saying that out loud. Anyway, so herring also has it. I guess maybe that made people feel better, right? Egg yolks, which again fall in and out of fashion. I think that currently they're in fashion. I think eggs are good if you can afford them.
And then, right now,
yes, and then liver, beef liver can be part of it, and fish liver too. Of course, there are some fortified foods that have D in it. Many of the milks, and not just the conventional milk, but your oat milk, your almond milks, soy milks will have some vitamin D fortification in it, as well as some of the cereals, orange juices. I'm cheating here looking at that. Cereals and orange juices. Vitamin D3 has been studied to be better absorbed by us as humans. And so that's why when we're looking for supplements, we usually suggest the vitamin D3. Vitamin D2 is not harmful to us. It just hasn't shown that we don't maximize our absorption with that as what we do with the vitamin D3.
Okay.
D3, when you're looking for a supplement, it is measured in IUs or international units.
Mhm.
If you read many studies, and Courtney will have some of the paperwork that I'm citing here. Truly, the FDA recommendation for vitamin D for women, I think, is up to 800 IUs, and or maybe it was at 600, and for men 800. I just have a hard time swallowing that, no pun intended, because it's just I have people who, like, that's probably a normal amount in a multivitamin. And I have a lot of patients that take a multivitamin and think that they're getting enough vitamin D and that they're still low. Again, maybe that's enough for them during summer months or when they're having higher exposures. But during the winter months, I would say that I truly recommend probably at a minimum 1,000 to 2,000 IUs. And that's per day. And if somebody is deficient, I usually bring them up to 5,000 IUs. One thing you and I had talked about was that I've had a number of patients that told me that they have a history of vitamin D deficiency. They might have even taken a prescription vitamin D at some point, and then when they were retested and their labs were normal again, then they were decreased on it. Some significantly, some to the point of like just dropping down to, again, like the 1,000 IUs. Well, guess what? Winter comes back around. We're not outside
Yeah.
again. And so that number, just to remember that is flexible, that it's going to go up when you are supplementing or making sure you're having the fortified foods or being outside. And then other times it's not. It also makes a difference with the sun exposure. I'm kind of jumping back and forth here too on the melanin in your skin. A darker pigmented skin is going to be a longer time to naturally absorb that from the sun.
Oh, interesting.
Yeah.
Okay.
Yeah.
No,
And
that's
it does
good to know.
its natural block.
So I wonder too if the recommendations, like those are more for surviving, not thriving, right?
Sure.
Like
Sure. So
that's why they're lower than maybe what you actually would
Yeah.
want, especially when you're not getting it
Yeah.
naturally from outside. so
And
much.
there's still a lot of ongoing research. Vitamin D deficiency is so common that they see it associated with many diagnoses. And I read one article that talked about some toxicity of vitamin D of a high level.
Right.
And one example was that it gave an irregular heartbeat. And I honestly, and maybe it's because I'm a provider in Wisconsin.
Oh, sure. I've
never had that toxicity. And so when you find something like vitamin D that's associated with so many diagnoses, that, yeah, everybody wants to increase the vitamin D. You know, for dementia, they recommend vitamin D. For asthma, they recommend vitamin D. For heart health, for bone health, we actually need the vitamin D to help our calcium absorb. And so we want to make sure that we're getting that in for just even bone health.
Right.
Anxiety and depression, we've talked about some of the moods and things like that too. I've had a number of patients that have kind of inexplicably like a spike of anxiety. And a lot of times when asked about their vitamin D, they're like, oh yeah, I forgot to restart that.
Yeah.
And that seems to be something that's helpful for them as well.
And I'm guessing that also means taking it with regularity.
Yes.
Like not just being like, oh, I took it 2 days this week, and then maybe I
Yeah.
forget for 3 weeks, and then I took it for a full week, but then
Yeah.
I forget for another
Yeah.
2
Yeah.
weeks.
Regular use would be best.
Would be helpful.
Yeah. And you don't have to really pay a lot for vitamin D. There's a lot of different good brands that are out there for overall for vitamins. Doing a capsule or a chewable vitamin can be good, or even like a gel, a liquid filled. The theory is that, again, if we have good gut health, that it should be able to break that down and absorb it a little bit better than maybe a really hard, large pill.
Yeah.
I'm not being plugged by them, but I get mine at Trader Joe's.
Oh,
I
sure,
did some
right.
research a long time ago, and that's what I honed in on. And so it's not terribly expensive, and I probably look like a crazy lady
But
when I
it's
go there and I
good
check the
quality.
dates and I grab 3 bananas and leave. Yeah. Yeah, but it's good quality, and it's just a little gel pearl.
Okay.
Yeah.
Yeah, those are easy to swallow.
Yeah.
let's see. I guess we're whoa, right at time. Does anyone have any questions? Feel free to type them in the chat or come off of mute. I'm not seeing any questions. All right, I'll stop